theme. But Andrea asked me to talk today a little bit about metabolism. It's kind of, and I have my notes are on my iPhone, so I've advanced, I guess. I'm not texting, although. But I do want to just spend a moment before that, kind of, because I'm looking at the agenda here. It's myself, and then we have some diabetes, nutrition, peer support, substance abuse, student-assisted nutrition. So, something kind of weird happened, or I don't know if it's weird, but I would never thought of a doctor when I wanted to be a physician get so specialized and so technical. So a couple things happened. So that's in physicians in general. Just basically kind of triage. A lot of us are just triaging procedures in a shorter amount of time. 50, 60 years ago, there weren't as many things to triage. You had your stethoscope and you had your mind, and maybe take some blood. But now it's just it's lots of decision trees. So that takes us into our head, and the ability to connect is probably reduced. I mean, it's great because there's a lot more people want certainty, and we can try to give more certainty, but something happens in that process. The second thing that happened, that's in physicians in general. The second thing that happened also is for psychiatrists. It's a weird thing. Psychiatrists a lot of times, not all of us, and I don't want to speak too broadly, but there is a sense that they want to be doctors. You're in that little gray area of mental health and physical health. That's in this area, thank God, not as bifurcated, and so there was a desire, I think, for a lot of, historically, for psychiatrists, many of us, to feel like they really earned their white coat. And what happened in probably the 70s, 60s, 70s, and 80s was the introduction of medications. And doctors prescribe meds. And meds are cheap, and they're not cheap to you and not cheap to the body, but you can do it quickly. And so psychiatrists all of a sudden, or not all of a sudden, gradually, now it feels all of a sudden, are basically prescribing medications. And so that's kind of what most do. And so the ability for psychiatrists to have a broad range of training is hit or miss. Some of us have social work and therapy background, some don't. All can pretty much write medications. So something happened along the way. So when I see wellness and health coaching, I'm thinking to myself, how did this come to this spot where that massive and most important part of health is now not in the doctor's office? It's now here in the job fair. And I think those are two of the issues that so I'm glad you're here. I'm sad that we're not able these days to provide, but it's good now we have more people on the team. So that's my little pitch about where we're at. Hopefully that puts things in context from our perspective, my perspective at least. But so metabolism, now I moved to my iPhone. Meet me at lunch. I'm just kidding. So first, she asked me to talk about the metabolism, and I think, what's metabolism? Break things down and digest. That's what I think. I think metabolism, I think about in junior high or high school, they've got really fast metabolism, so they're not heavy. That's what. But I looked it up on my dictionary, Wikipedia, and it says it's actually interesting. I learned a lot. Wikipedia, metabolism, from Greek, metabolize, to change, is a set of life-sustaining chemical transformations within the cells of living organisms. These enzyme-catalyzed reactions allow organisms to grow, reproduce, maintain their structures. Okay, I have no idea what that means, but I do. It's essentially putting stuff in your body, chemicals in your body, and then breaking them down for the body to use. It's pretty much metabolism. And so how does that play into mental health? So mental health and wellness, and one of the things is that the change in psychiatry has been the introduction of medications into people's mental health. As a major role of the psychiatrist. And, we all have different feelings about that, but many patients are on medications. Many want to get off. Many need them, some don't. So it's something that many people with mental health, almost everyone with mental health, has struggled with this issue of taking medication. And so I want to talk a little bit about, in two realms, what that means for health, overall health. The first thing is, that I think Andrea mentioned it earlier, before getting into that, is mental health has impact on weight and metabolism and energy to begin with. People that are depressed sometimes don't move, they sit around. They can't have the energy, they gain weight, they lose weight, they change their intake, they change what they put in their body, they take drugs. So there's a way that mental health directly has an impact on the metabolic process of the human being. To the point actually that some people, like if anyone's got bipolar or knows people that are bipolar, there's a term called rapid metabolizers. And it's actually quite powerful that someone who's in a manic state or a psychotic state will chew through their meds that they're taking so much faster than someone who's not. Their brain is going much faster, their body is going much faster, and so the chemical transformations of the things they put in their body go much different. So that's, I think, one takeaway is, that the body and our lives are changing. So what you do one day may be how your body takes something one day, maybe different than the next day, especially for people that have a cycling disorder, or a cycling, not necessarily disorder, a cycling process in their body. I try to stay away from disorders and stuff, but it's been ingrained in me, so it's hard to take that away. The second thing would be the introduction of medications has massively changed what many people's bodies look like and feel like. And many people don't like medications because of that. It makes them feel dull and slow and dead. We're trying to save their life, and they already feel dead when they're taking their meds, so why take them? So our goal is not to do that, and that's where, I think, limiting medications or trying to get on a regimen that someone feels is in their best interest is critical, because we want them to live a life that's worth living, or that they feel is worth living. We're not doing just ER or ICU mental health resuscitation. It's trying to get people into their life, into the booth back there. So it's key to talk about. So historically medications, the biggest problem with them were movement disorders. I think many of you are familiar with that. The medications were creating tics and movements and just restlessness. That was the first generation medications. More recently, there's been a whole new crop of them that have come out that, and where I'm finally getting to this, is weight gain. That's the big thing, is the metabolic disorders related to medications. And it should be it's on every doctor's mind, it's on most patients. The biggest thing that I hear is, I don't want to take that medication, I don't want to gain weight. I might hear other things too, but that's a big problem. So what does that mean? Well, it means that the first thing it means is that communication is critical. That what's compliance rate in medications in medicine? Probably like 30%. I mean, not just mental health. Who finishes a course of antibiotics? Who takes their hypertension medication? I mean, it takes support, it takes remind. Who can remember to do it? Who wants, so it's a big effort. So one of the things I think that the community engagement is critical support is that depressed and thought-changed people are isolated typically. And so the skills to connect with them, to find out what's going on, a lot of times can be solving themselves. If you talk with them, they may be more likely to go to the garden. They may be likely actually to move from the bed out. They may be likely to get out. So having a connection with someone in the community can change the metabolic needs of somebody. The second thing is, I lost my train of thought. I'm off the script here. Let's see, hang on. The other issue is that we live lives of crises, and a lot of times we catch or we intercept or interact with mental health clients when they're times of crisis. And that's frequently the time when we're least receptive to change or help. And it's sometimes forced on people, unfortunately. So what I try to do is to try to intercept people and give them something during that process that makes their pain have a silver or copper or some type of line that you can get something out of this. And one of the things is to check in on their metabolism. So if they're hospitalized, if they are in the clinic, getting labs can be very, very helpful. It can, and sometimes we're used to injecting things into people, and sometimes they're much more willing to give you blood than to actually a giving thing versus getting stuck with something. So to check in on the lipids. So the three areas of metabolism that we're worried about are weight gain, lipid fat profile in the body and sugar profile in the body. In proteins, we're not that worried about. We want people to eat, but we're not really monitoring that. And that the protein consumption accumulation doesn't really cause problems in the body. I mean, nutritionists can correct me if I'm wrong, but it's really worried about gaining weight, having too much sugar, diabetes, and then having cardiovascular issues. So we want to check it. We want to say we're concerned about it. And the thing that I like to do the best is get clients connected with a primary care doctor. A lot of times I'm the bad guy. I write the meds, I put in the hospital, and they're not telling me everything because they know that I have some type of power a lot of times. I try to get past that, but a lot of times that's the issue. So that's where peer support, team support, primary care doctors can really feel that they're, I got 4 minutes, 4 seconds or 4 minutes?
4 minutes.
Okay. Can really feel like they're it's really important to connect them with them because that way they're able to have a check-in. So I guess the point would be that we're trying to be aware of those issues, fat, sugars, diabetes, and weight, and try to help people get to a place that they can be active and so to monitor those. The other thing I wanted to talk about is smoking, because cardiovascular issues and smoking are probably the two biggest things that we interact with. The first thing is to help create people to have a life that they feel they want to live so that they want to live longer. And that's my first goal. Is I'm not just trying to keep people alive so they have miserable lives. Not me to judge, but for them. And so they think that actually one of the theories is that the mortality rates are going down, or life expectancy is going up because of the massive movement towards stop smoking. So the one thing to notice about metabolism in smoking is why do so many of our clients with mental health issues, especially the ones who are on medications, smoke? It's a higher percentage. Are they bored? Are they getting a hit? So a couple of reasons. Probably the nicotine is probably a stimulant. It is a stimulant. Probably feels good. But there's a sense that nicotine enhances metabolism. Everyone has heard that when I stopped smoking, I gained weight. Well, why? Is it because you have a replacement behavior to eat food? Possibly. But also there's a thought that nicotine revs up metabolism. And it also revs up the metabolism of metabolizing, breaking down psychiatric meds. So if someone that's smoking is probably going to need a little bit more meds frequently than if they're not smoking. So people that don't want to take their meds smoke more less meds in their body. The other thing I think about with metabolism I also want to talk about is the thyroid. You've heard thyroid, why are we getting thyroid tests? Many of the medications so thyroid is the choreographer, you think of metabolism in the body. It sets the rhythm, the cadence of how fast you're metabolizing. Some of the medications that we do interfere with, like lithium particularly, can interfere with thyroid. So you want to make sure that the chemical director of how fast things are moving is monitored. The second issue is that people with disorders of metabolism, disorders of the thyroid, can gain weight or be depressed. I mean, it's like they're anxious. Those are like someone's anxious, depressed, or overweight. What's their thyroid? It's kind of a basic primary care screening test. So that's something else to be aware of. It kind of is a little bit of a hodgepodge of thoughts, a stream of conscious a little bit. I did write an outline, but I want to just talk about a couple things that you can do. If I had to have 3 big things that I would suggest people do that overall health and including their mental health, I'd say have a primary care doctor, whether it's in an integrated clinic or not. I think more points of contact are better. The second thing would be find a way to exercise with clients or with others. If you have a mental illness, find a way to exercise with someone else. Makes it more fun, has someone else hold you accountable, and get you active, and then that can lead to more. That can either be gardening, going to the gym, taking a class, walking a dog. A lot of times exercise can be coupled with volunteer projects. So I think I don't know if exercise is the right word, but it's just moving. What's my third thing? The third thing is to do something. I don't have a third thing. Those are the 2 most important things at the moment. You should pick a third thing for yourself, but something that the client wants to do. The third thing would be to find the silver lining in sometimes adverse interventions by the medical profession. what's in this for the patient? You know, like let's say you have to go to the hospital, you get a TB. I gotta get a TB. Well, now you got a TB test in your file. Now, if you want to go to that program at one point, you're one step closer. I mean, TB is a thing that it takes like a week. It's chest X-ray, quantiferin. So find something. I think finding something that actually is of value to the person when the situation isn't that promising. So I appreciate you being here. It's great to see the full house. It's great to see all the people, and hopefully that's a little bit of seeds to help jar your memory for the talk later today. Thank you.